Hello future doctors, how are you all? Welcome back to MedSteps YouTube channel. So today we are diving into a high yield and clinically important concept, that is leukocyte extravasation. The leukocyte extravasation means the journey of white blood cells from the bloodstream to the site of infection or injury. So this is a very favorite exam and viva question, and you will also see its relevance in pathology and immunology and pharmacology also. So first of all, leukocyte extravasation, it occurs mainly at post capillary venules, okay, and consists of four major steps, that is migration and rolling, and we can see tight binding, next diapedis and migration. Okay, so step by step we are going to discuss in this video. Okay, first one, step 1, we can see margination and rolling. Just imagine, you can see this image, yeah, this is margination and rolling. You can see with this image and you can easily understand. So just imagine a white blood cells is PMN. PMN means polymorphonuclear neutrophils. Okay, this is the white blood cell. It's like floating in bloodstream. In normal conditions it's in the center of the flow, but during inflammation, because of due to vasodilation, whenever your body getting inflammation or infection, that blood vessel will dilate, so that flow will be like will decrease or slower. So WBC, like white blood cells, will move toward the edges. This process is called margination. Okay, now coming the rolling, it's like WBC tapping along the vessel wall. This is mediated by selectins. You can see here. So this is the endothelium and this is the interstitium. In endothelium, this is the space in between of the blood vessel. Okay, so in margination and rolling, what happening, that because of vasodilation, that process, that flow will decrease. So the WBC tapping we can see along the vessel wall, and it's mediated by this one, selectins. Okay, so here what are the molecules we can see here? First of all, in vasculature we can see endothelium cells. Okay, in endothelium cells attached with some molecules, we can see that thing we call E-selectin, this one, and another one P-selectin, this one. Okay, the E-selectin main function will be like it induced by tumor necrotic factor, and we can see interleukin 1. Yeah, you can see here E-selectin, it's upregulated by tumor necrotic factor and interleukin 1. Next, P-selectin. This P-selectin will be, it's released from Weber pallid bodies, and we can see glycam 1 and CD34. Okay, so in these leukocytes, we can see if any patient have defective in leukocyte adhesion deficiency type 2, then we can see like decreased Cialy-Lewis X. What is the main important means, this Cialy-Lewis, it mainly binds to selectin, selectins. If it's that Cialy is not there, then that patient will get this process deficiency. Okay, so this step is, if this step, and we can see some one L-selectin also. Okay, these are the leukocytes. So here this step is defective in like leukocyte adhesion deficiency type 2, like we can easily call LAD2. It's due to loss of Cialy-Lewis X. Okay, so another time I'm recalling this thing. So you can see here this image. So in blood vessel, this everything happening because of inflammation, vasodilation will happen. So the polymorphonuclear cells will come, and in endothelium we can see some molecules like E-selectin, P-selectin. the polymorphonuclear neutrophils will attach with E-selectin and P-selectin, and we can see one like leukocytes, that is Cialis levis X, it binds to selectins, and we can see L-selectin. Okay, so this is the in step 1 margination and rolling. Okay, now second one, in second step we can see that is after rolling the leukocyte needs to stick tightly. Okay, so this is tight binding, also called adhesion. If anything binding very hardly, then we call that is adhesion. Okay, here you can see in endothelium, in endothelium we can see here in tight binding ICAM1 and VCAM1. Okay, so here you can see some endothelial molecules, that is ICAM1. In ICAM1 we can see like CD54 and VCAM1 it's like CD106. Okay, in leukocyte integrations we can see like CD11 and 18 integrins like LFA1 and MAC1 and VLA4 integrin. These interactions are stronger than rolling and anchor the white blood cells to vessel wall. If any defective in leukocyte adhesion deficiency type 1 like LAD1 due to deficiency of CD18 integrin subunit. Okay, so here you can see the in this diagram the film adhesion is highlights with the LFA1 binding to ICAM, this one. Okay, so it will comes in tight binding with these molecules that polymorphonuclear cells will bind very hard. Okay, so next will be diapedesis. In diapedesis, also known as transmigration. Okay, diapedesis is also known as transmigration. Here then here you can see the WBC squeezes between endothelial cells to exit the bloodstream. This is diapedesis, also called transmigration. Okay, so in here what are the molecules is important means both like in endothelium and WBC we can see like PCAM1. Here this PCAM1 mostly the molecule will be like CD31. Okay, it acts like a zipper. It helping the leukocyte pass through the junction of endothelial cells. If you are seeing here, this PCAM will act like a zipper. Okay, and it helps the leukocyte to pass through the junction of the endothelial cells. Okay, you can see here this image. Here you can see the WBC crossing the vessel wall using PCAM1. Okay, so in PCAM1 the WBC travels endothelial cells and exits blood vessels. You can tell easily like this. Next one, migration. In migration, once the WBC, that means white blood cells, is in the interstitial tissue, it migrates toward the site of injury or infection. So this polymorphonuclear cells, it will go when it's coming to interstitial space, then it migrates towards the site of injury or infection. Okay, so this is guided by chemotactic signals. So where we will get this chemotactic factors means we can see C5a. Okay, next one interleukin 8 and LTB4 and kallikrein and platelet activating factors. Okay, so these are the things you can see in leukocyte extravasation. So here main important for your exams, if any person asking like in clinical relevance, I am going to discuss now LAD1. Okay, so LAD1 means leukocyte adhesion deficiency 1 coming means we can see CD18 deficiency or poor adhesion. In LAD2 we can see like Cialis levis X deficiency, it's defective in rolling, and PCAM1 is crucial for transmigration, and chemotaxis is essential for infection targeting, like impaired in some immune disorders. So that's leukocyte extravasation, a highly coordinated 4 steps process that's essential for your immune defense. So I think you understood this thing perfectly. If you have any doubts, you can ask me in comment section. So if this video is helpful, then you can like, share and subscribe. We will meet in our next video. Take care. Bye bye.